All right, welcome to the team-based learning lecture number 3. This will be on blood typing and hemostasis, also known as blood clotting. Okay, so we'll start out with the blood typing portion of it, and the background information you need to know to understand blood typing is the fact that all cells have proteins in their cell membranes. Okay, and most of these cells are going to be the same between people. For example, sodium potassium pumps, sodium channels, all these different kinds of proteins we have in our cells are all going to be similar. But then we have proteins that are unique to each individual person, and those proteins are called antigens. Okay, and blood groups are according to the antigens that people have on their red blood cells. Okay, so if you don't have a certain type of antigen on your red blood cells, then you have the antibody for that, meaning that your immune system has built up immunity against red blood cells containing antigens that you don't have. Okay, so that's a key thing in understanding the red blood cell typing or blood typing. And this slide is just showing what happens if you get blood that is of a blood type that is not yours, a blood type that's not compatible with your blood. And so the initial reaction you get is called agglutination. And agglutination really means clumping of cells together. Okay, these when you get blood that is not your blood type that you can receive. So in this case, we have type A blood, so type A antigens. That means this person is going to have type anti-B antibodies. Okay, they don't have type A antibodies, they have type B antibodies because they don't have type B antigens on their red blood cells. So in this case, let's say somebody gave them blood, type B blood, and what happens is that those red blood cells come in, they have antigens that are going to be attacked by the antibodies already in the blood. Okay, so those antigens stick to those antibodies and they start clumping all the red blood cells together. That's called agglutination. Okay, so when all these get stuck together, this clogs up small blood vessels. Okay, and that can lead to lack of blood flow in certain areas. Okay, what also happens besides that is these red blood cells can rupture, okay, or be destroyed by the immune system via phagocytosis. And when these red blood cells rupture, that dumps hemoglobin out into the bloodstream, and that's going to be problematic. And so the secondary consequences of that are, one, since we have less red blood cells and we have some clogging, we have decreased oxygen carrying capacity. We can also have decreased blood flow because of the clogging and the clotting of blood. And then all this hemoglobin that gets dumped out into the blood goes to the kidneys and can lead to kidney failure. And this can lead to death pretty quickly if it's not treated. Okay, so the other part of blood typing is this thing called the RH factor, RH grouping. Okay, so the RH factor was discovered first in rhesus monkeys, these little guys right here, and that's why it's called RH. Okay, so about 85% of Americans are RH positive, meaning that they have the antigen or the RH antigen on their red blood cells. Okay, with this one, it's a little bit different. The antibodies aren't spontaneously formed. So people that are RH positive people that are RH negative does not mean that they'll have RH anti-RH antibodies. But if they get two infusions, one infusion of the wrong type of blood, then the body will make antigens against that, antibodies against that type of blood. And then if they get a second one, that can lead to problems. This is also a problem with pregnancy. Okay, so in this example over here on the slide, it shows a mom who is RH negative, okay, and a baby who is RH positive. All right, and so the problem with this is not on the first pregnancy, but the second pregnancy. So the first pregnancy, there's not going to be any problems. Okay, and that's because mom does not have the antibodies against RH antigen yet. And so that first pregnancy, during delivery and during pregnancy, you have a little bit of mixing of blood, especially during delivery. And so then you get antibodies that are going to form against this RH factor. Okay, so then the second pregnancy comes along, and the mother's antibodies, mom now has antibodies against the baby's blood, and the antibodies can get through the barrier of the blood between the mom and the baby, and the baby's blood can be destroyed by the mom's immune system. This leads to what's called hemolytic disease of the newborn, just meaning destroying the red blood cells. And so This is always checked for now by checking the mom's blood, and if the mom is Rh negative, then they give her Rogam, which is a drug that contains antibodies against the Rh antibodies and destroys them. And so this is given no matter what. If mom is Rh negative, they'll give this drug, and that'll be given at 28 weeks during the pregnancy, and then again within a couple days of delivery, because that's really when the big problems and lots of blood mixing happens, is during delivery. So it's definitely important to understand that Rh grouping. Okay, and so this slide really just goes through the different blood types. Okay, these are the AB blood types. So blood types are over here on the left, and then the other important part is on the red blood cells, which antigens do they have, and this is showing it in an illustration, and then which antibodies do they have, and then which blood can they receive. Okay, one thing to know here is that when someone gets a blood transfusion, the antibodies don't go over, just the red blood cells. Okay, so someone who is AB blood, that means they have both A and B antigens, as shown here. So that would mean they have no antibodies, okay, because they don't have antibodies against either one. So that means they can take any blood. They're the universal recipient. Okay, people with type B blood have only B antigens. So you can see here they have B antigens, and that means they have anti-A antibodies. Okay, and that's what's shown here. Okay, and so then the blood they can receive is type B blood or type O blood. Okay, and well, type A blood are going to be just the opposite of that. They have A antigens, anti-B antibodies, and they can receive A and O blood. And then type O blood has no antigens, meaning that they have all the antibodies, and then so they have all the antibodies, A and B, and these guys are the universal donors. Okay, I'm O negative, meaning that I have all antibodies and no antigens, so my blood can be given to anybody, so the blood banks are always hounding me for that. So definitely important to understand and know this table here. Okay, so we're gonna transition over to blood clotting now, hemostasis. Okay, so very important to understand the difference between homeostasis and hemostasis. Homeostasis is just normal balance of all activities in your body, whereas hemostasis is blood clotting. Okay, so during homeostasis, when we don't need to be clotting our blood, we have mostly anti-hemostatic factors dominating, meaning things that are going to stop blood from clotting. Those things are dominating during homeostasis. Okay, a few things that lead to blood not clotting when we don't want it to. One is the endothelial cells lining arteries. They release nitric oxide and also prostacyclin. These things go against clotting. Okay, basophils and mast cells are both cells of the immune system. They release a chemical called heparin, which also prevents clotting from happening. And then we also have fibrinolytic factors. And what this means is things that break up blood clots. Okay, tissue plasminogen activator, we're going to talk about that more, plasmin. Okay, so fibrinolysis is breaking up a blood clot. So all this is happening when we don't have any bleeding going on, when we don't want to clot our blood. Okay, so then the problem comes in when we have a bleed. Okay, so we disrupt homeostasis, vascular injury occurs. Okay, so the initial primary goal is going to be to decrease the amount of blood flow going to that area. Okay, so that happens by vascular spasm. Okay, so when we have damage to a blood vessel like this, we damage some smooth muscle. Right, so that smooth muscle that's damaged, all of it around it is going to contract, leading to spasm like this. So that's going to decrease the amount of blood going to that area. Also, those endothelial cells that got destroyed are releasing all the contents of their cells. That's going to also lead to more spasm, also lead to pain receptors being stimulated, which also leads to more spasm. Okay, so the more tissue damage you have, the more spasm, the more vasoconstriction. So all of that is leading to slowing down blood flow to the area, and this allows us time to start forming a platelet plug as well as a blood clot. Okay, so the first thing that happens after vascular spasm is platelet activation. So remember, you have platelets all over your body, all through your blood, and these, what happens is as soon as these contact collagen, they're not supposed to be contacting collagen, they're supposed to be just in the vascular system, but if the vascular system breaks and there's collagen fibers sticking out all over the place. And so as soon as these touch collagen, they become activated. So this is inactivated platelets becoming activated and fully activated platelets. Okay, so once they get activated, they swell and they get really sticky and they get these long arms sticking out. Okay, so when they become activated, they release a couple chemicals. One chemical called ADP, adenosine diphosphate, and this causes other platelets to become activated and to come to the scene and aggregate in that area. And they also release serotonin and thromboxane A2. Okay, both of these also cause aggregation of platelets as well as spasm of those blood vessels. You're going to want to remember these two later. Two very common drugs that deal with blood clotting act against those. Okay, so this platelet plug is the first thing to form after vascular spasm happens. So you can see here, step one is the platelets start sticking to the exposed collagen fibers, as shown here. This would be the blood vessel. This is where the damage is. Okay, so we start getting some platelet aggregation. Then those platelets become activated, and they release serotonin, ADP, thromboxane A2. That starts calling in more platelets to become activated. More platelets get stuck in there, so we start clogging up this area with platelets. And so we get what's called the platelet plug, which is a temporary blockage of blood flow. Okay, and so this is kind of what you feel like after you. This is kind of gross, but after you pop a zit, and you and there's no more blood coming out after you give it a second to plug up, but then there's still a little bit of clear liquid coming out. That's because you have a platelet plug. The platelet plug is tight enough to not let red blood cells through, but it lets plasma through, and that's what that little clear leakage is.
Okay, so this slide is just looking at the overall general process of hemostasis. And what we've got here is step 1, vascular spasm, which we've already talked about. Step 2, platelet plug formation, which we just finished talking about. And now what we're going to be doing is moving on to step 3, which is truly the coagulation process. And you can see this schematic down here. Vascular spasm, platelet plug formation, coagulation, and then we have two other steps, clot retraction. It's kind of pulling it all together, and thrombolysis, that's breaking up the clot. And so I would definitely recommend looking at figure 19, or what 19.1, and that's for this down here. Then this 19.16 is a very good overview of the big picture of all of these steps put together.
Okay, so one thing to remember with coagulation is really what we're doing is we're reinforcing the platelet plug with this glue, which is fibrin. Okay, all of the different steps along the way are driven by clotting factors, which are plasma proteins. They're always in the blood, and most of them are made by the liver. A lot of these need vitamin K to be made. At least 4 of them do. Okay, so low vitamin K means not able to clot your blood. So a few things to remember with each step. Each of these phases has an end goal. I want you to know the end goal of each phase. Each step involves one factor, one protein that leads to activating another protein and turning it into an enzyme. Okay, and so those are what you're going to need to know for each step. Okay, so again, another overview. So phase 1, we have the goal of phase 1 is to form factor 10. Okay, factor 10 is the end goal. Okay, factor 10 is going to combine with other factors to form prothrombin activator. Okay, so that's really the end goal of phase 1. But first of all, we have the intrinsic and extrinsic pathway, which both lead to factor 10, and then factor 10 leads to prothrombin activator. Okay, phase 2, there's just one pathway. It's a common pathway, and that just converts prothrombin into thrombin. Okay, so prothrombin activator is converting prothrombin into thrombin. And then finally, phase 3, thrombin is what's going to turn fibrinogen into fibrin. Okay, so within phase 1, there's two different pathways, two different ways to get to factor 10. Okay, and so both pathways are triggered by the same tissue damage, so they're both happening at the same time, and then they both move towards the activation of factor 10. Okay, so the differences between these, though, are the intrinsic pathway is all due to factors found in the blood. That's why it's called intrinsic. Okay, extrinsic is due to factors found outside the blood, in the tissues of where the damage is, and that's the main factor is called tissue factor, and that's not normally in the blood. Okay, intrinsic is much slower, extrinsic is much faster, and the more damage we have, the more tissue factor we have released, and the more powerful clotting we have, and that's important for more damage leading to more clotting. Okay, so then after we form factor 10 through either the intrinsic or extrinsic pathway, factor 10 is going to become activated and become factor 10A, which leads to the formation of prothrombinase, or also known as prothrombin activator. Okay, so that's the goal of phase 1, is to make prothrombinase or prothrombin activator. Okay, in phase 2, really all we're doing is taking that prothrombinase we made in phase 1 and making that turn prothrombin into thrombin. Okay, so prothrombin activator is right here, prothrombinase is right here, causing prothrombin to be turned into thrombin. Okay, so the goal of phase 2 is to make thrombin, and now phase 3, thrombin is going to act as a catalyst to turn fibrinogen, which is another plasma protein we always find, into fibrin. Okay, so this is the only step where we're not converting one protein into an enzyme. We're converting this protein fibrinogen into an insoluble protein called fibrin, which is really going to be the sticky fibrous mesh that forms the blood clot. Okay, so then fibrin sticks together and forms these long hair-like bands, holds all the platelets together, and this is really the structural basis of the clot. Okay, so after we form our clot with that fibrin, one of the things that starts happening about 30 to 60 minutes after the injury is the clot starts getting pulled together, getting squeezed down. This is a really interesting thing because we actually have actin and myosin proteins floating through our blood at all times, and so when the clot is made, we have a bunch of actin and myosin that's already found in that clot. Just like in skeletal muscle, when it's told to do so, it starts contracting and starts pulling the clot together. So it's another use of these proteins, actin and myosin, that we see in skeletal muscle and smooth muscle and cardiac muscle, but it actually also works to pull the clot together, which is kind of cool. And what that does is it squeezes the serum out of the clot and compacts it down. Okay, so then the platelets in this area also a part of this, and so the platelets that are stuck in that clot, and at this point they start releasing something called platelet-derived growth factor, and the endothelial cells in this area start releasing vascular endothelial growth factor. So you'll notice both of these are growth factors, so these both stimulate healing. They start stimulating healing of the blood vessel, of the tissues around it, and so this is happening after this blood clot occurs. Healing starts right away with retraction of the blood clot. Okay, and then finally we need to, after the tissue is all healed and we want to get rid of the clot, we go through a process called fibrinolysis, which really just means breaking up the clot and getting rid of it. We don't need it anymore because the tissue is all healed. So the main chemical involved in this, the main protein involved in this, is called plasmin. Okay, and this is the activated form of a protein that's always found in the blood called plasminogen. And this was already in the clot during the clotting process. It's already there, and it becomes activated by a protein that's an enzyme that's released called tissue plasminogen activator. Okay, and tissue plasminogen activator is a very important one. It's a clot busting drug, and it's going to be used clinically in stroke patients that get to the hospital quick enough, and we find out that there's a clot causing that stroke. They can give them tissue plasminogen activator, and it can break up that clot and actually save some brain damage from happening. Okay, this usually starts about 2 days after the clot, but takes several days to finish. And really, the end goal is just to remove the clot, get it out of the way, because we don't need it anymore because the tissue's healed. Okay, and that really finishes up hemostasis. So I'm not going to go through this, but you guys should definitely kind of fill this out, the events of each, why we do this, and the important chemicals involved. Okay, so we're going to talk a little bit about some blood clotting problems, and then that'll be it. So these are all just some definitions that you should be familiar with. So what's a thrombus, what's an embolus, and what's an embolism? Okay, you can look at those definitions on your own. Blood clotting happens because of atherosclerosis, which is really cardiovascular disease, and then also because of stasis, meaning blood not moving enough. So this is being in bed for a long time, bed rest, or sitting on a plane for a long time. This can lead to some blood clotting because those clotting factors get built up and they're not washed away like they should be. Okay, so a couple specific things that we do to treat blood clotting disorders. And so these are some drugs that you definitely need to be familiar with the names and know exactly how they work. So up here we're looking at a platelet, and we have two drugs that act against platelet activation. So one you're very familiar with, it's called aspirin. Aspirin, what it does, it blocks this COX-1 pathway, which leads to the formation of thromboxane A2. So remember, when those platelets get activated, they release thromboxane A2. That's going to call for more platelets to aggregate and cause more blood and more of that platelet plug to form. If we take aspirin, that blocks that from happening, so platelets can't release thromboxane A2. If we take another drug called clopidogrel, which is also known as Plavix, another very common clotting drug, it blocks ADP from binding to platelets, which also causes activation of platelets. So both of these drugs stop platelet activation. Okay. Heparin is another very common blood clotting drug. It stops blood clotting. What it does is it holds thrombin to antithrombin more. And so antithrombin is the enzyme that stops thrombin from working. And so heparin holds them together and actually blocks thrombin more effectively. So this is going to slow down blood clotting. This is given very commonly after surgery to avoid blood clotting. A couple more. Coumadin or warfarin. This is indirectly inhibits thrombin formation. You can see up here where the C is. Yeah, so where these, where the W's are. The W's are all part of what's being blocked by warfarin. Really, what you need to know is that it stops thrombin from being formed. If we don't have thrombin, we can't change fibrinogen into fibrin. We can't make a clot. Dabigatran or Pradaxa is another very common one. It also directly inhibits thrombin, so it actually blocks thrombin from doing its job here. Okay, so some important drugs that you need to be familiar with. Okay, a few other clotting disorders. This one's called DIC, or disseminated intravascular coagulation. This is a very serious disease, very serious condition that will most likely kill the person if it happens. This is what happens here is uncontrolled clotting in all the blood vessels. So for some reason, all of your blood starts clotting at the same time. This leads to clogging blood flow, which leads to cell death, which leads to tissue death, which also leads to rupture of blood vessels. And so we have bleeding because all these blood vessels ruptured, but we can't clot the blood because all of the clotting factors were just used up. And this leads to multiple organ failure and death. And this can be caused by sepsis, which is just an infection in the blood. Blood transfusions are very, very rarely can happen due to pregnancy. Okay, a couple other disorders here. Bleeding disorders. Thrombocytopenia means a low platelet count. Okay, and this leads to small little bleeding all over the body. This is very common in babies that don't have enough platelets yet. These little red blotches are called petechiae. And then this is platelet counts, low platelet counts. And the treatment for this is really just giving the baby platelets until their body's able to make them on their own. Also, impaired liver function can lead to bleeding because most of these enzymes and proteins are made in the liver. And so if the liver's not working, we don't make these clotting factors and we can't clot. Also, vitamin K deficiency is problematic because a lot of these enzymes require vitamin K. Okay, last clotting disorder here are hemophilias, and these are hereditary bleeding disorders where the person is missing one or more of the clotting factors. Their body just can't make it. And so they have to be treated by giving them these clotting factors in the blood with blood transfusions. It's very, very expensive. One of the most costly diseases in the world to treat, somewhere between $60,000 to $150,000 a year that the patient has to pay out of pocket. And lastly, if we do have a bleed, we have lots of bleeding, then we lose lots of blood. And the number one concern is not oxygen. The number one concern is blood pressure. Okay, and so if we have really low blood volume because of losing a lot of blood, the number one concern is getting blood volume back up. So there's no time to figure out what kind of blood they need, no time to match the blood. They just need to get volume back up so blood pressure can be restored. So the first step is always just giving them some fluid, something like this. So normal saline fluid or lactated ringers, another really common one. You guys will be more familiar with this, especially the nursing majors when you get into your clinicals. But very, very common to put a solution like this in first to get blood pressure back up, and then later come back in and give the correct red blood cells after blood pressure has been maintained. All right, guys, that'll do it.